It's officially Parkinson's Awareness Month. This year, we'll be sharing the ABCs of PD to spread the word about Parkinson's disease from A to Z. Follow along this month as we highlight one aspect of PD for each letter of the alphabet. Find resources or help spread the word about Parkinson's disease by visiting parkinson.org/awareness. The Parkinson's Foundation is a nonprofit focused on bettering the lives of those living with Parkinson's through improving care and advancing research. Importantly, everything we do is in close concert with our community to ensure that our actions are aligned with the needs and the priorities of those living with and impacted by Parkinson's. Today's program will provide a basic overview of Parkinson's disease. We will learn what Parkinson's is, what causes it, common symptoms, treatments, and strategies for managing symptoms. PD Health at Home is presented by the Light of Day Foundation, whose generosity has made this programming possible. We'd like to thank this webinar sponsor, Sarah Vance, for their support of our mission. Thank you. The Parkinson's Foundation provides weekly education and wellness programs virtually through our PD Health at Home series, which includes Mindfulness Mondays, Wellness Wednesdays, Fitness Fridays, our expert briefings, and our Spanish language programming, EP Salud en Casa. There's still a lot we don't know about Parkinson's disease, and through research efforts are being made to close the gaps in our knowledge and understanding. In addition to the development of new therapies for symptom management, research also seeks to find ways to stop progression and ultimately end Parkinson's disease. On April 10th, we will be hosting an expert briefing where we will learn about current research that is taking various approaches to develop a treatment that may significantly slow PD's progression. Find out more and register for our PD Health at Home programs at parkinson.org/PD Health. To begin our formal presentation, we'd like to introduce today's expert presenter. Dr. Cloud received her MD in 2004 from the Medical College of Georgia. She then completed her neurology residency, clinical movement disorder fellowship, and master's degree in clinical research at Emory University. She joined the Virginia Commonwealth University faculty in 2011. Dr. Cloud's research focuses on the gastrointestinal features of Parkinson's disease. She also has a second line of research that focuses on the use of wearable devices to analyze and treat motor problems in Parkinson's. She has had grants from the Michael J. Fox Foundation and the National Institutes of Health for her investigator-initiated work in both of these research areas. She has been a site investigator on numerous industry trials. She's an active member of the Parkinson Study Group, and she's the medical director of the Parkinson's Foundation Center of Excellence at the Virginia Commonwealth University. Dr. Cloud, it is such an honor to have you here today. I will pass the mic to you.
Hi, everyone. Thank you for having me today. I'm excited to be here. Let me share screen. Can someone confirm that you can see my slides?
Looks great.
Okay, perfect. So let me start by telling you that these are my disclosures. So our learning objectives for the next 45 minutes are shown here. So it's my hope that by the end of this talk, everyone here will be able to describe and discuss all of the symptoms of Parkinson's disease, specifically the early symptoms of Parkinson's disease. I also hope everyone will be able to explain how we diagnose Parkinson's disease and then discuss how we manage early Parkinson's disease. And last but not least, I hope that everyone will be able to use something that you learned today to go out and improve your own quality of life. So let's get started. So what is Parkinson's disease? Parkinson's disease is an incurable and progressive neurological disease, which sounds ominous, right? But The good news is that while there is no cure, there are many highly effective treatments that can help to manage the symptoms quite effectively over the duration of the disease course. So while it's not curable, it is very treatable and manageable. So, Parkinson's disease has a variety of symptoms. It can affect one's movement, but it also has a lot of effects on things that have nothing to do with movement, including mood and thinking skills, as well as other things that we'll discuss a little later. And in addition to medical treatments that can be provided by your medical team, there are things that are in your power that you can do to help to manage your symptoms and improve your quality of life. So, the key take home point is that despite the fact that this is a progressive and incurable disease, people with Parkinson's can absolutely live very well for many years in the context of this disease, provided that they educate themselves and find the right care team and are proactive in managing their symptoms. So, who is affected by Parkinson's disease? The truth is, anyone can be affected. It doesn't matter your gender, your race, your ethnicity, it can happen to anyone. It is a disease that's more common in older individuals. The average age of onset is in the early 60s. But that being said, it can happen much earlier. And it's estimated that around 2 to 10% are what we call young onset, which can happen in much younger patients. And in general, we say that approximately 1 million people in the United States are estimated to have Parkinson's disease. So this is um, quite common, and chances are that you probably know other people who have Parkinson's in your social circles. So, what are the early possible symptoms of Parkinson's disease? I think before we even start to discuss them, it's important to point out that not everybody with Parkinson's disease has all of these symptoms. And certainly in the beginning, you may not have all of these symptoms. You may only have one or two of these symptoms. So keep that in mind. But some of the possible early symptoms are tremor, stiffness of the muscles, slowing down of the movement. In general, overall, you just move a little slower. You may have changes in your walking, difficulty walking, changes in your balance, changes in your facial expression. You may have what we call masked face, which is where you just don't look as animated. Your facial expressions are not as lively as they used to be. You may notice that your handwriting is smaller. You may notice that you don't speak as loudly, or your voice may be more monotone, less animated as well. And then there are also some possible symptoms that are what we call non-motor. They don't have to do with movement. That can be an early symptom. So losing your sense of smell, constipation, dizziness or lightheadedness from low blood pressure upon standing up. So these are all possible early signs and symptoms of the disease. And again, you may have one or two or all of them. Um, so what causes Parkinson's disease? So the truth is the cause is not really known, but it's currently believed that it's a combination of genetic factors and environmental factors that lead to the development of the disease. There appears to be a 10 to 15% occurrence of an identifiable genetic mutation in the population at large. And there are certain environmental exposures that have been identified that we know are risk factors. So, certain pesticides, for example, are known to be a risk factor. And then, other risk factors are older age and traumatic brain injuries, especially recurrent traumatic brain injuries. We know that increases one's risk of developing Parkinson's disease in the future. And so no one event is clearly linked to the development of Parkinson's disease for, any one given individual. We sort of assume that it's a combination of genetic susceptibility and environmental exposures in most cases. So, what's happening in the brain in someone with Parkinson's disease? So, the cells in the brain that produce a chemical called dopamine become sick. They don't function as well as they should, and they slowly die off over time. Dopamine is a neurotransmitter or a chemical in the brain that is important for coordinating normal movements. But it's also important for a lot of other things. It's important for speech and sleep and thinking skills and mood and a whole lot more. And so when our brains are not producing enough dopamine, we see abnormalities in all of those areas. And so that historically has been what we have thought of as the primary underlying brain abnormality of Parkinson's disease. However, in recent years, we have sort of broadened our understanding of the disease, and we now know that there are other neurotransmitters in the brain or other chemicals in the brain aside from dopamine that are also important in Parkinson's disease. But dopamine is still the primary focus in terms of our therapeutic approach because it's the primary chemical that is responsible for the abnormal movement. And so most of the drugs that we're going to talk about for treating the symptoms are going to target dopamine. So, what do you need to know about the symptoms of Parkinson's disease? So, some of this I've already kind of touched on, but it's important to keep in mind that symptoms develop slowly over time. So, you don't just wake up one day and have, the full constellation of Parkinson's disease symptoms. This process starts slowly and evolves over time. Um, and it evolves slowly over time. I can't emphasize this enough. This is not a rapidly progressive disease. If you have a rapidly progressive disease that looks like Parkinson's, chances are you don't actually have garden variety Parkinson's disease. You may have a related disorder, but Parkinson's disease itself should be slowly progressive. Um, Parkinson's disease is categorized as a movement disorder because the primary physical manifestations that you can see with your eyes are movement problems like tremors or shaking, slowness of movement, which we call bradykinesia. So instead of moving nice and fast, movements are slower than they should be or smaller than they should be. And then stiffness in the body, which may or may not be perceptible to the individual, but it's perceptible to the physician who's examining you. In addition to affecting the brain, Parkinson's disease affects other systems of the body. It's not, just a brain disorder. So we see a variety of other body systems impacted. I, alluded to some of those non-motor symptoms earlier. So there are a variety of gastrointestinal symptoms such as constipation, which is extraordinarily common. You can have nausea, you can have difficulty swallowing. There are urinary symptoms such as overactive bladder, where you have to urinate very often or urgently, particularly at night, having to get up and go to the bathroom too often at night, which in turn disrupts sleep. So lots of other body systems can be impacted as well. So it's important to keep in mind that the symptoms are quite broad. They impact movement, they impact other body systems other than just the brain. And they're highly variable from person to person, and the symptoms progress very slowly over time. You'll hear a lot of people say there's an adage that Parkinson's patients are like snowflakes. No two are exactly alike. And There's a lot of truth to that. No two people have exactly the same constellation of symptoms, and you don't have to spend a lot of time among individuals living with Parkinson's disease to realize how true that is. So it's a very diverse disease in terms of the way that it presents and the way that it evolves. So let's spend a little bit more time talking about the motor symptoms. So the main motor symptoms are the shaking or tremor, which typically is what we call a resting tremor. So that's a tremor that's present when the individual is not doing something with the body parts. So the hand shakes when the hand is not being used to do something. So not when you're eating or drinking, but when your hand is just resting on your lap and you're relaxed. That's the most common type of tremor. Now, that being said, we do sometimes see other types of tremor, but that's sort of the classic one. And it's generally asymmetric, meaning that it's going to start on one side of the body, the right or the left. Doesn't matter which side, but the key is that it starts on one side. And while it will eventually spread to the other side, it will always be worse on the side on which it starts. So it's asymmetric in starting on one side, and it remains asymmetric over the course of the disease. Not everybody gets a tremor, so you do not have to have a tremor to be diagnosed with Parkinson's disease. You have to have 2 out of the 4 main physical findings that we're talking about on this slide, so keep that in mind as well. So the next one is slowness of movement or bradykinesia, which we talked about. Again, that's just when your movements are slower than they should be. And this can be noted in a variety of ways. So, your friends or your family might notice that it takes you longer to get up out of a chair, or when you walk, maybe you don't swing your arms as much as you used to. Maybe it's taking longer to just get dressed in the morning. So, this may manifest in a variety of ways. Stiffness or rigidity in the body is something that, again, you may or may not be aware of. Often people are, though, aware of it because it can be uncomfortable for some people. They may perceive it as soreness, pain, particularly if it's severe, they will experience that sometimes as pain in the joints of the limb that is stiff. So oftentimes people are aware of this. And then the last of the 4, what we call main or cardinal motor features, is problems or changes in your walking or your balance. And this is, of the 4, the least likely to be present early on, but it can be. So those are the key physical motor findings that you can see with your eyes, and you need 2 out of the 4 to be diagnosed. So keep that in mind. You don't have to have all of them. So the non-motor symptoms, again, there's a wide array. Just to give you an idea of the spectrum, there are mood symptoms such as depression and anxiety, which are extremely common, and fortunately, often very, easy to treat. Then there is something called apathy, which is sort of a loss of motivation, lack of that get up and go. Uh, and so that is something that can sometimes develop and be quite frustrating, not so much for the individual typically, but for the spouse or for family members. And then we can sometimes see changes in thinking and memory. So early on, we often see trouble with um, what we call executive functions. So people will describe difficulty multitasking, um, difficulty with attention, and they may just feel like they're doing things a little slower. It takes them longer to process and to do things than they used to. They may have a little difficulty with word finding and remembering names. So those are some of the the changes in cognition. And then sleep problems are quite common. So we see a problem called REM behavior disorder, where when people have their REM sleep, their dream sleep, their muscles aren't paralyzed as they should be. And so that they can actually act out their dreams. Um, and again, that tends not to bother the individual so much, but it very much bothers the bed partner who can't sleep because the person next to them is talking, shouting, kicking, punching. And then restless leg syndrome is also quite common, sleep fragmentation, fatigue is very common. And then constipation, we've already talked about. So there's quite a wide spectrum of non-motor symptoms that can occur over the course of the disease. And these can really occur at any time, early in disease, late in disease. They can occur at any time. And again, not everybody gets all of these symptoms. You may have some of them, you may have none of them, you may have all of them. Everyone is different. Um, And I should also just mention that all of these are treatable in some way, shape, or form. And so if you have any of these symptoms, it's important to mention them to your neurologist because there are things we can do to help with all of these symptoms. Okay, so how do we diagnose Parkinson's disease? So Parkinson's is what we call a clinical diagnosis. So what that means is that there is no one test that we can order that will easily make the diagnosis accurately. This is not like diabetes where we can draw your blood and send it to a lab and get a yes or no answer with any degree of certainty, which is frustrating. It's frustrating for you and it's frustrating, for us as well. So we have to rely on your history and your physical exam to make the diagnosis. Um, The criteria that most of us use require that you have 2 out of the 4 of those motor exam findings that we talked about earlier. And if you have 2 out of the 4, with one of them being slowness of movement, that's enough for us to say that we think you might have Parkinson's disease. Is that definite? No. And anybody who tells you that they're absolutely certain that that's what you have is out of their mind, because there's no way we can be certain based off of just that. But we can say we think you probably have Parkinson's or that you might have Parkinson's. And then typically what we will do is we will either initiate a trial of medication for Parkinson's disease and see if you have a positive response to that, in which case that would provide additional support for the diagnosis. Or if you're not in a place where you're really ready to start medication, we could consider ordering an additional test that might provide additional support for the diagnosis. Or we could watch and wait, which is also a perfectly reasonable approach. And so it may take some time to get a more uh, certain or confident diagnosis. This is not something that can be diagnosed instantaneously in most cases. So, what are some of those additional tests that we can do to support the diagnosis? One of them is called a DAT scan. This is a special type of CAT scan that looks at the levels of dopamine transporters in the brain, and it looks for a reduction, essentially. It looks for a loss of them, which occurs in Parkinson's disease. If your DAT scan is abnormal, that strongly supports a diagnosis of Parkinson's disease. But you would never make the diagnosis of Parkinson's disease solely on the basis of an abnormal DAT scan, because a DAT scan is also abnormal in a variety of other Parkinson's-like diseases that are not Parkinson's disease. And also, a DAT scan is not a perfect test. There are false positives, there are false negatives. And so it's really most helpful when it's used as one piece of data to support an overall clinical impression rather than using it as a piece of information in a vacuum in isolation. It's not shown on this slide, but there is another test that's available that can be used in a similar way, which is a skin biopsy to look for a protein called alpha synuclein in the small nerves in your skin. This is a procedure that can be done in clinic. It's not a big deal. It's just three small punch biopsies, like the ones you would get in a dermatologist's office. And if alpha synuclein is present in those nerves, that would also support a diagnosis. But again, like the DAT scan, not specific for Parkinson's disease because there are other diseases aside from Parkinson's disease where you might find alpha synuclein in those nerves. So again, these are tests that you might consider to support the diagnosis, but they cannot be used alone to make the diagnosis. The most important thing is that physician's exam and clinical impression. So once you've been told we think you might have Parkinson's disease, the next logical question is, when should I start treatment? So the most important thing to keep in mind is that the treatments available do not cure the underlying disease. And furthermore, they don't even significantly slow the underlying disease process. So when we say treatment, we don't really mean that you're treating the underlying disease process. We mean that you're treating the symptoms. This is symptomatic treatment. Okay, that's important to keep in mind. So the decision about when to start treatment should depend upon when you are bothered by your symptoms enough to justify taking medicine for it. So people have different tolerances for symptoms. Some people have a little bit of tremor in their left hand and they're right-handed, and that little bit of tremor doesn't bother them at all, and they can live with that for years before they feel the need to treat it. Other people may have a tremendous amount of stiffness and slowness in their right hand, and they may be right-handed, and that could be very disabling for them, and they may want to treat that right away. So you really have to look at the individual situation, think through how much it bothers the individual, and really let the individual tell you, their thoughts on when they need treatment. And from my perspective as a physician, if I think that someone really looks like they are struggling and I really think they need medication, I may say, hey, I can't help but notice you seem to really be struggling to get up out of a chair, and it seems to be hard for you to do these things in clinic. Are you sure that you don't really need anything? I mean, I may offer that, opinion, but at the end of the day, my personal philosophy is that the patient really needs to guide the timing on this because they are the one that is living with these symptoms day in and day out, and therefore they are really the only ones who know how bothersome this is. I think spouse opinion, it can be very helpful too, though. So this has to be a discussion and a shared decision between the physician and the patient about when it's really time to start treating the symptoms. Treating the symptoms of Parkinson's disease is a team sport. I cannot emphasize this enough. In addition to a neurologist over the course of the illness, chances are you will need a physical therapist, an occupational therapist, a speech and language pathologist, maybe a social worker, nurses, potentially other professionals, perhaps a genetic counselor. I could keep going. So, if at all possible, finding your way to a clinic or a healthcare system that can provide you access to a diverse array of specialists who are familiar with the disease will behoove you. Because this, like I said, it's a team sport and it works better if all of the members of your team are talking to each other. And so, I think that's key, and it makes a big difference. Finding a good physician is the first step. It's the first step to getting the right diagnosis. It's also probably the most important step in making sure that you're gonna feel comfortable with all of the subsequent decisions that you're gonna have to make. So, it's extremely important to find a physician that you're comfortable with. Again, can't emphasize that enough. I think that in a perfect world, everyone would see a movement disorders specialist. That's a neurologist who's done additional fellowship training in movement disorders. But the reality is that not everyone lives in an area where they have access to a movement disorder specialist. And so um, that may not be an option. So I think the goal is to find a neurologist in your area who uh, has the most experience with Parkinson's disease that you can find, and who you can talk to, and who you trust, and who you feel comfortable with. They can have all the experience in the world, but if you can't have a conversation with them, they're of no use to you. So I think equally as important as their training and experience is their ability to communicate effectively with you. Um, if you're having trouble finding someone in your area, the foundation can absolutely help you. They have a helpline, which is shown here on the slide, and they can absolutely help you try to find someone in your area. So, how do we treat the symptoms of Parkinson's? So, there are medical treatments that involve medications. There are surgical treatments as well, which we'll talk about in a moment. And then there are things that don't involve medicine or surgery, like exercise, PT, physical therapy, occupational therapy, speech therapy, which can be extraordinarily helpful. And so often the treatment involves a combination of, especially in early Parkinson's disease, of exercise, sometimes just exercise, and then plus or minus some medications. And then as the disease advances, we start to pull in some of these other things. So, what are the medications that we use to treat the movement or motor symptoms of the disease? The main medication that we use is called levodopa. This is a medication that is converted into dopamine in the brain. So, we are just giving your body back the dopamine that it's not making enough of. Most of the newer practice guidelines strongly encourage the use of levodopa as a first line treatment for just about everyone with Parkinson's disease, with very few exceptions. So, this is really the main medication that we use. Other medications include dopamine agonists, which are medications which can bind to the dopamine receptors and essentially convince your brain that it is seeing more dopamine, but they are not actually dopamine. And these medications can be helpful, but they have a lot more side effects than levodopa. And that's why the guidelines have really tried to steer doctors more toward using levodopa. MAOB inhibitors work by preserving dopamine in the brain, and these are a nice choice for newly diagnosed patients who have motor symptoms that are maybe annoying but not disabling. So if you are not disabled by your symptoms, but you definitely have symptoms and they do annoy you a little bit or they bother you, but you're not disabled in any way, these are a good choice because these are not extremely potent medications like levodopa, but they do help some. And so it's a good choice for early mild PD symptoms. And we also use them in more advanced disease as an add-on to levodopa. And then there are medications like the COMT inhibitors, which are add-ons to levodopa to help levodopa last longer, work better, et cetera. And there's a few other categories that are not shown here, but um, for the sake of today's talk, they're not terribly relevant. Surgical options, which again, this is really for more advanced disease, so not super relevant to the newly diagnosed, but just know that in advanced disease, when medications are no longer effectively controlling symptoms, there are surgical treatments available, which can really be a game changer for people and dramatically improve quality of life. So there's a couple of surgical approaches. One is called deep brain stimulation surgery, and this is a method that involves implanting an electrode in the brain, which provides low levels of electrical stimulation to treat the symptoms of Parkinson's disease. It treats the motor symptoms, not the non-motor symptoms. And it does a great job. And it often enables people to take less medication and it enables them to respond better to their medication. And it can dramatically improve overall quality of life. There's a newer type of surgical approach called focused ultrasound, which is non-invasive and uses a very focused beam of ultrasound waves to essentially burn a small hole, make a what we call a lesion in the brain to treat the motor symptoms of Parkinson's, mostly tremor. Um, and that can be an option for people who are not good candidates for deep brain stimulation for whatever reason. And then we have infusion medications for advanced Parkinson's disease when oral medications are not enough. So if people need their medication, their levodopa infused around the clock, we have ways to do that. So one is to infuse it directly into the small bowel, which is the site of absorption of levodopa. And then not FDA approved yet, but coming soon is a subcutaneous infusion. What can you do without your doctor to manage your symptoms? Exercise. So exercise has been shown across multiple studies to help not only to slow disease progression, but to improve symptoms in the here and now. So exercise is hands down the most important thing that you can do for yourself. I typically recommend that people strive for a minimum of 150 hours a week of exercise. And I tell people that I don't really care what kind of exercise you do. It needs to be something that you enjoy, because if you enjoy it, you are more likely to do it on a regular basis. So find something that you like and just do it. But the key is that it needs to be work. Leisurely walking your dog and not breaking a sweat is not exercise. You have to get your heart rate up. You have to be sweating. You need to be breathing heavily. I tell people, you should be working hard enough that if someone tries to talk to you, you can answer them, but you don't want to. All right. Like if you're at that level, that's good. 150 minutes a week. Nutrition. So, sadly, we don't have as much data on nutrition as we do on exercise, but we do have some. So, what we can tell you is that a more Mediterranean-like diet is good for the brain. It's a brain healthy diet, and so that is going to be a diet that is high in fish and other types of seafood, low in red meat and poultry. It doesn't mean that you can't ever have it. It just means low. high in fresh fruits and vegetables, and the more colorful the fruits and vegetables, the better, because you're getting lots of antioxidants, which again are good for your brain. You want your primary source of added fat to be extra virgin olive oil, not butter. And then you want to make sure you're getting plenty of fiber from those fruits and vegetables and whole grains, because that's going to help stave off the constipation. It's also going to help keep you full and have a variety of other health benefits. And you want to make sure you're getting plenty of water. Um, I usually recommend for women to shoot for at least 2 liters a day, and for men, 2.5 to 3 liters a day of water. None of us get enough. And again, that's going to help with constipation. It's going to help prevent orthostatic hypotension. It's going to help with many things. So, 5 steps to living well with Parkinson's as we kind of wind down. Number 1, you want to think about what's most important to you in your life. And, everyone is different. So, what's important to you? What are your goals? What do you want to make sure that you prioritize moving forward, as you're um, navigating your disease? Number 2, find a doctor that you like and that you trust. And if you're having trouble doing that, reach out to the foundation. They can help. Um, Number 3, find someone that you can talk to. I often think that it's best if this is not your spouse or a family member, but if you can find someone, either through an online support group or an in-person support group, but someone who knows what you're going through. Um, that is often much more helpful than trying to talk to someone who's not actually been in your shoes. Um, Really try to carve out and create those healthy habits, getting the right nutrition, sleep, exercise, etc. And number 5, again, just be active, exercise, exercise, exercise. So there's a lot that's in your control that you can do. Getting, the diagnosis, you can't control that, but these are things that are absolutely in your control and that you can do to make your situation better. Research is another thing that you can do that will maybe not make your situation better, although it might, but it will absolutely make someone else's situation better down the road. So, research is essential for helping us to better understand the disease and improve treatments for future generations. So, if you are so inclined, consider volunteering to participate in a research study. And there are many ways that you can do that. If you are getting your care at an academic medical center, there will often have clinical trials available there that you can participate in. If not, you can always go to clinicaltrials.gov. You can put in your zip code and you can put in your diagnosis and you can put in how many miles you're willing to travel and come up with a list of all of the clinical trials in that area that are open to people with Parkinson's disease, and you can seek out a trial that way. Fox Trial Finder is another nice online resource that can help match you to clinical trials in your geographic area. So there are lots of ways, and there's also this helpline through the foundation that can help put you in contact with options as well. So just a plug for research. So final takeaways: Parkinson's disease symptoms absolutely can be managed effectively over many years. You can live a good life for a long time in spite of the diagnosis. Symptoms vary from person to person and can include movement and non-movement symptoms. And a personalized treatment approach with a comprehensive team of providers is the best way to go to get the best possible long-term outcomes. We already talked about the fact that this is Parkinson's Awareness Month. So I will stop there and we can take questions.
Thank you, Dr. Cloud. I know, and for all of you who are joining us, I know that embracing a diagnosis or starting to learn about how Parkinson's disease might be impacting a loved one in your life can feel overwhelming. And so I hope that this particular webinar was a nice introduction to embracing a journey with Parkinson's disease as we begin to shift and move and flow through life with what we know as a movement disorder. So thank you so much, Dr. Cloud, for your time. I really wanted to start with one aspect that really has a large impact to not only their persons with Parkinson's, but their spouses, their care partners, their loved one that might become sort of the care partner or caregiver. Can you offer some essential knowledge or words of wisdom that you might offer our care partners, caregivers, spouses, or loved ones who are also impacted by Parkinson's disease?
Sure. I think that it's important early on to educate yourself as well. Learn as much as you can. I think that the earlier you do that, the better off the both of you will be. I think that coming to appointments is most welcome by physicians. I think not everybody intuitively knows that, but I think your presence at medical appointments is absolutely encouraged and welcome. You, as the significant other, see things that your spouse who is living with this disease may or may not appreciate about themselves. You may observe changes in them that they themselves don't see. And so your opinion is vital. And so I think learning as much as you can early on, paying attention to what's going on, coming to follow-up appointments to provide that additional history can be extremely helpful. Even if you can't come, just jotting some notes down maybe and sending it with them to the appointment is helpful, or typing up a note in the portal and sending it to the physician um, is very useful. There are also support groups available exclusively for partners and caregivers, and I think that um, that can be also great, a great resource, because you have your own stressors and you're on your own journey in this that is different from the individual who's living with the disease, and finding a support system for yourself, I think is incredibly valuable. And so seeking that out might also be worthwhile at some point. I could keep going, but I think off the top of my head, those are kind of my key points.
Great. Thank you, Dr. Cloud. And we have a dedicated programming website, web pages, books, even podcast blogs for those of you who might identify as a care partner for someone living with Parkinson's disease. I'll ask that Laura or Jenny, if you could please put a care partner resource link in the chat for our friends to connect with. Dr. Cloud, Ron, I'm going to start firing off some questions because we have quite a lot of engagement from our viewers today. So Ron is asking, what's the best way to treat anxiety?
It depends, because anxiety can be very different in the way that it manifests. So some people have anxiety all the time. They're just always worried about everything all the time. And that's obviously very different than people who have very specific situational anxiety. Some people only get anxious in certain situations. Some people just have anxiety attacks randomly when they least expect it for no apparent reason. And so these are all treated differently. So, it sort of depends on the details, but If someone has what we call generalized anxiety, where they're just sort of anxious all the time, most of us like to use a class of medications called SSRIs, which are um, selective serotonin reuptake inhibitors. These are used for anxiety and depression. They're very safe, and they're very effective. And we typically start with those unless there's a compelling reason not to. Um, so that's generally our first line for generalized anxiety. If it's situational, like panic attacks, or only when the person rides in a car, or something that happens infrequently, then we might just use an as needed medication that works quickly that they would only take in those scenarios. And that's a totally different kind of category of medications. But um, SSRIs are usually first line for generalized anxiety.
Thank you, Dr. Cloud. Suzanne is shifting us into exploring pain and Parkinson's. Is pain a symptom of Parkinson's disease?
Yes. And it is one of the most challenging to diagnose and treat because it can manifest in such different ways. And so when someone's complaining of pain, we have to try to figure out, is it related to the Parkinson's disease, or is it related to any number of other things that can cause pain, right? Just because you have Parkinson's disease doesn't mean you're immune to, other common problems. If something's hurting, it could just be arthritis or a pulled muscle or, any number of common things that just happen, right? Um, and so once we rule out all those other things, if we think it's related to the Parkinson's, then we have to figure out what's causing it. So what related to the Parkinson's is causing it? Is it hurting because there's too much stiffness or rigidity, in which case we might need more Parkinson's disease medications? Is it more of a kind of burny, stingy, tingly kind of pain that sounds more neuropathic, in which case we might use a totally different type of medication for neuropathic pain medications. So the short answer is it's complicated. And even for movement disorder specialists, I would say the pain is probably the hardest symptom to treat of all of our non-motor symptoms because it's just so hard to figure out what's causing it sometimes. But it absolutely can be Parkinson's related. It often is. And it can be treated effectively, but it can take quite a bit of trial and error to figure out how to treat it effectively. And our colleagues in PT can be very helpful. I'll put in a plug for PT. Um, they, in addition to doing traditional physical therapy to help manage pain, they can do techniques like dry needling and other things that can really help with focal pain. So oftentimes PT can help us with that as well.
Thanks for bringing some awareness to our healthcare professionals outside of the doctorates. We recently hosted an expert briefing on pain and Parkinson's, understanding how it's related to Parkinson's disease. And I'll ask Jenny or Laura to drop that link in the chat for our expert briefing on pain and Parkinson's. And real quickly, we're getting a lot of specific questions that go beyond the generalization of Parkinson's disease. Questions such as, let's see, coping skills, Parkinson's and sleep, constipation, and nutrition. Just want to share that we have in-depth webinars that cover these topics on a deeper level. And Dr. Cloud, I know that you have a specific interest in gastrointestinal relations with Parkinson's disease. So I'd like us to address the question from HK. Other than constipation, is bloating and flatulence related to Parkinson's disease? How can it be treated?
Absolutely. So, yes, is the short answer. So, upper GI symptoms like bloating, feeling full too soon after meals, abdominal pain, especially after meals, excessive belching, um, can be related to underlying slow digestion, food sitting in the stomach too long. And that's extremely common in Parkinson's disease. It's also sometimes made worse by levodopa. And so you can get a double whammy. You can have slow digestion from your Parkinson's disease, and then we give you a medication that makes it even slower. You're welcome. So, um, what can we do about it? The good news is it's usually pretty mild for most people. If it's not mild, if you're one of the unlucky people who has it and it's not so mild and it's really bothering you, sometimes eating a diet that is specifically for people with slow digestion, which is a diet that isn't really a diet, it's more of a lifestyle where you eat 6 small meals a day instead of 3 large ones, and you drink plenty of fluids with each meal to kind of help things move through efficiently. Not laying down after meals, but staying upright for 2 hours after every meal to again promote things moving through the stomach quickly. Not taking too much fiber or fat at any one given meal. Obviously, you have to eat fiber, you have to eat fat, but spreading it out evenly throughout the day rather than sitting down and eating a whole head of cauliflower at one time. Not that anyone would ever do that, but you get my point. Um, so those are some things that you can do to try to manage your symptoms without medications. If you do that and that fails, then you can ask your neurologist to refer you to a gastroenterologist for further testing and management, because the gastroenterologists have lots of tricks up their sleeves to help if you have a really significant case of it. And they can also rule out other things that could be causing your symptoms.
Great. Looking at our time, want to respect your time and all of you who are present with us viewing from your homes. We'll take probably two more questions. So, one question I think could be answered pretty quickly. Can dopamine in the brain be measured?
Easily and super accurately in a living person, not really. The DAT scan is a nice proxy for that. You know, it's a easy, commercially available, tangible way to get an idea of whether uh, or not, you know, you have a deficiency. You know, that is the closest commercially available proxy I think that we have.
Is there a downside to starting levodopa therapy early?
Oh, that's such a loaded question. Um, you don't, in my humble opinion, you don't want to start any medication before you need it, right? Because why take a medication if you don't need it? You're just opening the door to side effects needlessly. And that goes for any kind of medication, not just Parkinson's disease medication. So if you truly don't need symptomatic therapy, my 2 cents is don't take it. Um, However, if you need symptomatic therapy, I also would say on the flip side, there is no reason to delay starting levodopa. There's no reason to fear starting levodopa. I think if you need it, you should take it. Um, you know, the longer you delay taking it when you really need it, the more you run the risk of accruing significant disability that in the long run is not going to serve you well. So, you know, I think you just have to have that ongoing conversation with your neurologist and be very honest with yourself about how much your symptoms are interfering in your day to day life to decide when the right time is.
And our final question from John, they share that my grandfather, my aunt, and now my father have all been diagnosed with Parkinson's, all same side of the family. I'm 49 years old and healthy. What can I do to minimize my chances of manifesting the disease, if any?
Exercise, exercise, exercise. If you don't have a gym membership, I would get one. Um, Although you don't have to go to a gym to exercise, but you know, I think aerobic exercise, as much of it as you can get, and maybe consider a Mediterranean diet. That's really all that we know right now that you can do that might be helpful. And of the two, the exercise is probably way more important than the diet. But if I were in your shoes, I would probably do both.
Thank you so much, Dr. Cloud, for your time today. Any final words before we close our session?
I would just add to that, and it's really applicable to everybody. My other thing that I think is important for everybody to remember is try not to worry too much about things that you can't control. Um, you can only control what you can control, and I think people in general should focus on what they can control. And I think that's, just good advice regardless of what you're facing.
Okay, thank you, Dr. Cloud, for offering your time and knowledge for today's Wellness Wednesday webinar for our Parkinson's 101. And a big thank you to each of you who joined us today. I just want to acknowledge that we did have a significant response to our question and answer session. And unfortunately, we weren't able to get to them all. Please, if your question was not answered, call our helpline. That number is 1-800-4PDINFO. And again, there is a lot we still don't know about Parkinson's disease. Research is key to unlocking its causes, developing life-changing treatments, and ultimately discovering a cure. Here you will find a few Parkinson's Foundation studies, as well as other websites to find a Parkinson's study near you. Learn more about how to get involved by visiting parkinson.org/research. We'd like to thank today's webinar sponsor, Ceravance, for their support of our mission. Thank you, Ceravance. Don't forget to visit our website, parkinson.org/awareness, to learn how you and your community can get engaged to support the Parkinson's Awareness Campaign. Everyone can participate at events on our website and on social media. You can find resources or help spread the word about Parkinson's disease by visiting parkinson.org/awareness. And here's that website for you to connect with, and our helpline information, the phone number and the email address there on the screen for you. And lastly, at the end of the webinar, your Zoom screen will prompt a survey. Our programming is fueled by your feedback. We appreciate you taking the time to let us know what you hope to learn more about in future sessions. Take care, and we'll see you at next week's expert briefing. Until then, be well.